You know that feeling of relief you get after your plane lands? Well, EMS goes through that every time we safely get an active labor to the hospital. I'm KO Medic, and I talk about simple, life-saving skills and other crap. This is because so many things can go wrong during the birthing process. It feels a lot like this. So, this goes without saying, but when it comes to birth, mom and baby should always be taken to the hospital, quickly and with no exceptions. But sometimes we need to help mom and baby before we can make it to the hospital. Listen, there are many more complications than the ones I will mention here, but I decided to cherry pick the ones you can actually do something about. Some of these tips will involve inserting fingers into personal spaces and private places. So I highly recommend you let mom know your intention and get permission. Dr. Seuss with it. So we touched on this in my last video. However, when the baby's head delivers, you want to check to see if the umbilical cord is wrapped around the baby's neck. This is fairly common, and often the cord is loose enough to gently loop back over the baby's head before delivery continues. In rare cases, you won't be able to slip the cord off the baby's neck. Perhaps because it's too tight, or because it's wrapped multiple times around the baby. Then you will need to use your fingers and do your best to keep it from getting too tight around the baby's neck, while letting the birth proceed. In very rare cases, the cord is so tight it must be cut to allow a safe delivery. Obviously, I recommend letting a trained medical professional cut the cord. However, if I had to do this and I wasn't on the ambulance, I would use clean shoelaces to tie off the umbilical cord in 2 places, and trauma shears to carefully cut in between my 2 knots. Hypothetically, of course. If the baby's head delivers but then seems to retract, like a turtle tucking its head into its shell, or it seems like the baby is no longer sliding out in spite of mom pushing, then the baby's shoulders may be stuck on mom's pubic bone. This is also common. However, you need to act quickly. You got about 5 minutes. No pressure. First, help mom bring one of her knees up to her chest, while at the same time gradually applying pressure just above her pubic region. Just be gentle and don't push hard on mom's abdomen. Explain to mom what is going on. If this doesn't seem to help, the next thing I would do is flip mom over onto her hands and knees. Next, you need to move one of mom's legs into sort of a runner's position. If you can tell which way the baby is turned, lift the leg on the same side as the baby's back. If you can't, just lift mom's right leg. Act like you're putting on a bracelet and make sure mom is on board for the next part. Insert your hand into mom, locate the baby's posterior shoulder, and try to rotate the baby to dislodge the shoulder. If mom is still unable to push, you can use your hand to try to reach in and find the baby's hand. If you can find it, grab it and gently pull the baby's arm out to free the shoulder. Just be ready to catch, because the baby may slide out fast after you dislodge the shoulder. Another thing you might see is the umbilical cord coming out first. This is actually pretty bad, but you can do something to help. The danger here is cutting off blood flow to the baby. Having mom position with her hips high and her shoulders low can help relieve pressure on the cord. And no, I'm not going to make a joke about this position. Occasionally, we can be adults on this channel. I don't recommend trying to push the cord back in. Messing with it may cause the umbilical cord artery to spasm, which could also be harmful to the baby. If the first thing you see is a baby's leg or a butt, then the baby is breech. There are special techniques to help deliver a breech baby. However, these techniques are extensively practiced by medical professionals. Believe me, I tried and I don't think I can simplify them. However, I will link some great videos on these techniques if you want to see them in action. I'm sorry, but they tell even us medics, don't deliver and don't delay. Get them to the hospital okay. Most of the time, this requires a surgical delivery. So, if at all possible, quickly get mom and baby to a hospital known for specializing in babies. The last thing I will mention is if mom has vaginal bleeding, with or without pain, her placenta may have ruptured. This can happen with or without trauma to the mother. In this case, you should treat for shock. I have a video on this I will also link. One thing extra though is to turn mom more to her left side by placing pillows or a folded blanket under her right side. Damn hero, you held on for our longest video yet. Good job. Now for some fun. Somewhere in this video I put an Easter egg. If you find it, comment with the timestamp. This will confuse people who don't watch the whole video. Be the first to find it and I will pin your comment to the top and give you a shout out in my next video. If you enjoyed this, here are some ways you can help the channel grow. Thanks for watching and take care.